Hello medicos. Today I will talk about the mitral valve defect. I already discussed about the aortic valve defect, means difference between aortic stenosis and aortic regurgitation. If you didn't watch the video, then go and watch the video. Link in the description. So today topic mitral valve defect. So in this video I will discuss about the mitral stenosis and mitral regurgitation. What is the difference between them? Also with the diagram of heart like mitral valve regurgitation and mitral valve stenosis. And after that I will discuss about the causes of both of them and the symptoms. What you will see the symptoms of mitral stenosis and mitral regurgitation. And then after I will discuss what is the diagnostic method like ECG, chest X-ray, and also in the echo what you will see in the patient echo, ECG and chest X-ray of mitral stenosis and mitral regurgitation. After that I will discuss about the treatment of this patient like when patient has asymptomatic, symptomatic, and also I will discuss about the surgical treatment of the mitral valve defect. So please focus those I will discuss in the video. So let's start the video. Mitral valve defect. Mitral valve defect occur when problem in the valves located between the left atrium and left ventricle. In aortic valve defect, I discussed that the problem occur into the left ventricles and the aorta. Left ventricles and aorta problem occur in the aortic regurgitation and aortic stenosis, aortic valve defect. But in the mitral valve defect, the problem occur into the in between the valves present between the left atrium and the left ventricle. So this is the problem occur between the left atrium and the left ventricle called mitral valve defect. There are two types of mitral valve defect. First is the mitral stenosis and second is the mitral regurgitation. Same as like as the aortic stenosis and aortic regurgitation. Stenosis means stiffness. Stiffness occur into the valves. Here is the stiffness occur in the valves of the between the left atrium and the left ventricle. So this is the stenosis means stiffness of the valves occur. But regurgitation means insufficiency. I already discussed regurgitation means insufficiency or incompetence. So this is the stiffness. Stiffness occur in this also, and in this regurgitation insufficiency. Insufficiency occur in the insufficiency occur into the left ventricles in this mitral regurgitation. So first of all discuss mitral stenosis. In this video I will discuss what is difference between both of these mitral stenosis and mitral regurgitation. Mostly there are same as like aortic stenosis and aortic regurgitation. So mitral stenosis and mitral regurgitation are mostly similar, not same, mostly similar problem. In this problem in opening of mitral valve. So opening problem, there is a problem in opening of mitral valve due to the calcification the narrowing of valves occur. Due to the calcification, narrowing of valves occur in this. Here you will see the normal heart where the valve open normally, but this is the stenotic heart, means mitral valve stenosis occur between the left atrium and the left ventricle. Here is the valve, mitral valve present between the left atrium and left ventricle. So this problem occur. Here you will see the narrowing of the valves occur in the between the left atrium and the left ventricle. So this is the narrowing of valve due to the calcification or any congenital defect like also rheumatic disease, rheumatic fever. This also causes the mitral stenosis. So this is the narrowing of the valves occur in the. So there is a problem in the opening of valve because no more opening in the valves occur. So this is problem of opening problem. Mitral stenosis is the opening problem. Here mitral regurgitation, it is a problem in closing of the valve present between the left atrium and the left ventricle. Here you will see here is the valves present between the left atrium and the left ventricle. This valve closed, here normally closed, but in this case is mitral regurgitation patient, you will see there is no closing of valve completely. Here you will see no closing of valve completely. So there is a problem in closing of the valve. This is called mitral regurgitation. So closing problem occur between the left atrium and left ventricle valve is called mitral regurgitation or mitral insufficiency. Due to this, backflow of blood occur from the left ventricle to the left atrium here. So backflow here is the insufficiency of left ventricle occur because backflow of the blood due to the non closing of the valve. So blood go back into the left atrium from the left ventricle. This is called mitral regurgitation or mitral insufficiency. Causes, mostly causes of the mitral stenosis causes is the rheumatic fever, congenital defect, or also calcification. But when in the examination they will ask, when examiner ask you which is the most common, so most common causes of the mitral stenosis is the rheumatic disease or rheumatic fever. What is the most causes of the mitral regurgitation? Mitral regurgitation causes is the rheumatic disease, left ventricular dilation, acute myocardial infarction, mitral valve prolapse, myxoma, congenital and Marfan syndrome patient also causes the mitral regurgitation. But when in the examination they will ask about which is the most common, so most common is the mitral regurgitation is the mitral valve prolapse. Mitral valve prolapse is the most common causes of the mitral regurgitation or mitral insufficiency. Mitral regurgitation mostly these are two types. These are two types, acute or same like as a aortic regurgitation and aortic stenosis. So acute and chronic. Acute and chronic. Acute chronic is also two types, compensated. Here I will write compensated and decompensated. Compensated and decompensated. Acute when due to sudden rupture of chorda tendini, due to the sudden rupture of chorda tendini or papillary muscles. You all know here is the papillary muscles present in the valves in this area, papillary muscle present. So problem into also in the papillary muscles. This is the acute type. And chronic is two types, compensated and decompensated. When it is called compensated, when acute phase is not treated medically, when acute not treated medically, like we will not provide any medication for the acute, then it is converted into the chronic form and compensated type of, because mitral regurgitation develops slowly after month and year it develop more. So there is a compensated, it is occur after the acute form for a long time. It's called compensated chronic. And decompensated chronic occur mostly due to the increase of the calcium overload in cardiac myocyte. So calcium overload in cardiac myocyte. Sorry, there is too much space congested, so here you will write too much congested. Sorry for this. So this is the two types, acute and chronic. Acute due to sudden rupture of chorda tendini or papillary muscle, so there is a acute mitral regurgitation occur. And chronic is two type, compensated and decompensated. Compensated mostly occur chronic form when acute form is not medicated by the medicine or it take for a long time like month and year, then it converted into the chronic compensated form. And decompensated form when the cardiac calcium overload occur by the in cardiac myocyte, so it's decompensated type of the mitral regurgitation, decompensated chronic type. So this is the causes of the mitral regurgitation. Most common cause is the mitral valve prolapse, but in the mitral stenosis most common cause is the rheumatic disease. Symptoms of mitral stenosis. Symptoms of mitral stenosis like dyspnea, palpitations, peripheral edema, fatigue, pinched or blue faces you will see, and Muller flush. Muller flush means you will see the patient has plum red like cheek. So this is the Muller flush, like plum plum red like chick. So plum red like chick appearance is called Muller flush. In some patient it also causes the chest pain. Chest pain you will also see in the patient like symptoms chest pain, and in the later stage when it's progress very much, so it's also causes the thromboembolism. So embolism also causes the, but in case of the late stage, not early stage, it is the progress stage, means late stage. This symptom you will see thromboembolism, you will see in the late stage of the mitral stenosis. What is the symptoms in case of the mitral regurgitation? You will see mostly same types of symptoms also in the mitral regurgitation, like dyspnea, peripheral edema, orthopnea, palpitation, also chest pain you will see in the patient of this, fatigue and weakness you will see also in case of the mitral regurgitation type of patient, because leakage occur from the, here you will say the leakage occur in, sorry, here you will see this is the heart and leakage occur in the valves from left ventricle to the left atrium. So this causes the weakness, because insufficiency in the left ventricle occur, because you will see the insufficiency into the left ventricle, so weakness, fatigue you will feel in the patient. Because when insufficient, like I will try to explain, when left ventricular insufficiency occur, here you will see the insufficiency of left ventricle, so less amount of blood pump into the body. When less amount of the blood pump into the body, so less amount of the blood reach to the organs, so it causes the insufficiency of blood into the different part of the organ, which causes the weakness and fatigue to the patient. So this is the symptoms of mitral stenosis and mitral regurgitation. What is investigation? Means what we will diagnose in the patient of mitral stenosis and mitral regurgitation. In the mitral stenosis patient, when you will take ECG of the patient, then you will see the left atrial enlargement. Here is the most common type of symptom like investigation. ECG left atrial enlargement means P mitrale, you will see the ECG of the patient. So P mitrale means two type of notch you will see in the P wave. So this is the P mitrale you will see in the patient of the mitral stenosis. Here you will two P wave notch present in the P in mitral stenosis patient. So you will see in the patient in ECG left atrial enlargement or P mitrale you will see in the patient. What is the chest x-ray? In the chest x-ray you will see the first of all calcification of the valves occur. So calcified valves you will see in the patient, calcified valve. Also you will see the left atrial enlargement, also you will see in the chest x-ray, and the chronic heart failure. Chronic heart failure also you will see, because chronic heart disease also in this patient, chronic heart disease patient also causes the mitral stenosis. So chronic heart failure also you will see in the chest x-ray of the patient. What is see you in the echo? Echo you will see in the reduced valve, like same as the mitral like same as the aortic stenosis. So reduce valve area. Valve area reduced because calcification or narrowing of the valve. So reduce valve area. On the basis of reduced valve area, it has also progressive mitral stenosis, severe mitral stenosis, and very severe mitral stenosis. Progresses when valve size 1.5 centimeter square, means greater than 1.5 centimeter. When valve size 1 to 1.5 centimeter square, then it is called severe type. But when valve size is less than 1 centimeter square, then it is called very severe. So this is the very severe type of the patient. There are three types: progressive mitral stenosis, like moderate or mild type, so 1 to 0.5 centimeter square area, greater than 1.5 centimeter square area. Here you will see the like valves. So here is the area is the 1.5 centimeter square greater than. But in the severe cases you will see less than 1, means 1 to 1.5 centimeter square area you will see in the severe type of the patient. And very severe type of patient you will see the area reduced to the 1 centimeter or less than 1 centimeter. So this is called you will see in the echo of the patient reduced valve area of the patient. Also you will see in the left arterial enlargement occur. In the echo you will also see this type left arterial enlargement occur. What is the investigation you will see in the mitral regurgitation or mitral insufficiency? You will see in the ECG of the patient. When you will take ECG of the patient, also you will see P mitrale, broad type of P mitrale you will see in the patient of mitral regurgitation. Also you will see the left arterial enlargement in the patient of mitral regurgitation or mitral insufficiency. What you will see in the chest x-ray? When you will take chest x-ray of the patient, so enlarged left arterial and left ventricle occur, because I already told, because in this case insufficiency occur, so hypertrophy of the heart occur. So left arterial and left ventricular enlargement occur in the chest x-ray when you will take of the patient. And also you will see the left arterial enlargement also you will see in the chest x-ray of the patient. And maybe calcification, you will see calcification same as like this, same as like mitral stenosis, calcification of mitral valves you will see in the patient of the mitral regurgitation also. But it is rarely, not, it is mostly you will see the calcification of mitral valves when both type of problem occur, mitral stenosis and mitral regurgitation both type. So you will see also in the calcification of mitral valve occur in the chest x-ray. What you will see in the echo of the patient? Echo of the patient, when you will take the echo of the patient, then also you will see same as dilation of left atrium and the left ventricle, and decrease of the left ventricular function, because I already told that there is the less blood in this, because blood go from left ventricle to the left atrium, so less blood into the left ventricle, less blood to the body, so function of the left ventricle decreases because it pump less amount of blood to the different part of the organs, so it causes the left ventricle function decreases. So this is the investigation of mitral regurgitation, and this is the investigation of the mitral stenosis. What is the treatment? Treatment, mostly we will give the when patient has asymptomatic, means no symptoms of the mitral stenosis, then we will provide the only, no necessary any treatment, only provide the echo monitoring. Means when patient come, always check in the 1 to 2 year, every 1 to 2 year echo of the patient. So echo monitoring of the patient always within 1 and 2 years. As when patient has symptomatic, when means a patient has symptom, then management by the echo, and also we will provide the beta blockers. When we will give the beta blockers, like when patient has hypertension patient, also patient has angina, so we will provide the beta blocker. When patient has heart failure patient, then we will provide the digoxin, and also we will give diuretics in heart failure patient. So we will provide drugs, and also management with the echo and also the drugs which cause when patient has symptomatic, means symptoms appear in the patient. So we will provide both drugs, antibiotics, drugs like beta blocker, digoxin, diuretics, this type of drug, and also monitoring by the echo. And what is the surgical treatment? So there is the replacement of these valves, replacement or repair of the mitral valves. So we will provide the mitral valves repair or mitral valves replacement. Mitral valves replacement also occur. And also when the patient has very young, then we will also balloon valvectomy, like same as the aortic stenosis, balloon valvuloplasty when patient is young patient, balloon valvuloplasty. So when we will provide balloon valvuloplasty, so when the here you will see when the space is less, I will make a diagram, then you will understand very clearly. When you will see the less space means narrow area, then when balloon valvotomy occur, then it's called dilation of the area, dilation which causes the increase in the surface area, so which causes the dilation. So this is the balloon valvotomy, but it is occur only in the young patient because the young patient has no problem, but in the old patient it causes the destruction of the valves occur because it's a mature heart, so it causes the destruction of the heart also occur valves, so only occur in the valves young patient. Balloon valvectomy only occur in the young patient, not in the old patient or any aged patient. What is the treatment in the aortic means mitral regurgitation? Mitral regurgitation has patient when a patient has asymptomatic same as like mitral stenosis, we will provide the only monitoring of echo. So echo monitoring occur in the asymptomatic patient. When patient is symptomatic, then we will decrease, first of all decrease preload, because I already told that this mitral regurgitation mostly occur by the mitral valve prolapse. So decrease preload, like we will provide the diuretics, so decrease the preload and decrease also post load, decrease post load of the heart. So after load or post load which cause, so we will give the ACE inhibitors we will provide for post load decreasement. So in this symptomatic patient we will provide the diuretic and ACE inhibitor, and also echo management always done for the symptomatic type of patient. What is the surgical treatment? Surgical treatment same as the like mitral stenosis, we will provide the mitral valve repair or mitral valve replacement. Here mitral valve repair and mitral valve replacement occur in the patient of the mitral regurgitation. So this is the difference between the mitral stenosis and mitral regurgitation patient. So mitral stenosis mostly occur is the problem in the opening of the valve, but mitral regurgitation of a problem in the closing of valve. There is no closing of valve, so blood leakage from the left ventricle to the left atrium. So this is the closing problem, but this is the opening problem. Here opening problem occur mostly by the calcification or rheumatic heart disease patient occur mostly this is. So this is about the difference between the mitral stenosis and mitral regurgitation or mitral insufficiency patient. Thank you so much. If you have any doubt, you can ask me in the comment section, or also please join my Telegram group in which I will also give you topic wise, or also I will give the question daily MCQ which is already asked in the previous examination like NEET PG, FMG or AIMS PG, or possibility to ask. So join the Telegram group, link in the description